Consumer wearables started as basic pedometers. Today, they are sophisticated pieces of hardware attached to millions of wrists. We're tracking deeply personal data every second of the day. People are monitoring their sleep cycles, syncing their daily blood work, and mapping their metabolic response to GLP-1s in real time. Yet, despite generating billions of data points, a disconnect remains. If you take all this information to a standard clinic, most physicians will simply brush it aside. Healthcare professionals don't need raw data dumps. A generic recovery score of 72 sitting isolated on a screen doesn't offer any usable clinical context. We treat continuous medical telemetry like a lifestyle novelty because we are trying to compare one person's daily output against a vast generic population average. General population averages provide a useful starting point, but they can't capture the nuanced shifts unique to your own biology. For wearable data to become medically viable, it must be interpreted against your own established history. This is the N=1 approach. It requires the study and tracking of a single, deeply documented human baseline over a significant period of time. To understand how this digital health bridge functions, we can examine a case study built on 9 continuous years of biometric monitoring. Fixing the future of healthcare data requires us to zoom in on the specific hardware, firmware, and fuel of one exact individual. This brings us to Ron Henson's ARC shielding protocol, a structured, joint-centric conditioning system. It functions as an ongoing longitudinal study, mapping the autobiography of a nervous system learning to survive instability over nearly a decade. The data relies on precise physical input. The protocol uses a 360-degree clockwork pattern on an elliptical machine, applying multi-directional load to the joints. Testing the body in this repeatable environment creates a reliable baseline to accurately measure internal responses. True health tracking demands this kind of structure. A consistent physical input is required to generate trustworthy physiological output. The tech industry continues to push a winner-take-all mentality, but human biology is too complex for one perfect sensor to capture everything. Currently, wearables exist in fragmented silos: Apple, Polar, Oura, Welltory. The solution is physiological fusion modeling. It breaks down those walls, synchronizing physical load, autonomic regulation, and metabolic health into one cohesive picture. Clinically, this yields immediate clarity. It allows us to see when the body carries severe, unseen sympathetic strain, long before an actual physical breakdown happens. Data stops being noise the moment multiple streams cross-reference each other to interpret the unique individual rather than the device. This interpretation layer provides a new way for clinicians to engage with patient data, focusing on actionable insights rather than raw numbers. Instead of handing a doctor a chaotic spreadsheet of step counts, the fusion model translates that data into a clean, readable clinical file. We can call this smart triaging. An active AI layer filters the daily noise, monitoring the patient's baseline securely without adding to the doctor's paperwork. The physician is only flagged to intervene when that specific individual's data drastically deviates from their established historical norm. This targeted early warning system allows clinicians to focus only on high-risk deviations, providing a predictive edge while minimizing the burden of raw data. For the everyday user, this creates an interoperability mandate. It makes absolutely zero physiological sense to throw away years of wearable data simply because you bought a different brand of watch. When you abandon that old data, you erase your body's history. You lose the record of how you adapt to stress, your illness response patterns, and your aging trajectory. Your physiological history needs to belong to you. It should serve your long-term health, rather than remaining locked inside a tech company's proprietary platform. Securing that personal baseline is how we map a body that lasts a lifetime. It ensures that when the hardest days inevitably hit, your nervous system is already equipped to handle the load.